So I overheard a discussion this morning. It was an attending talking to her resident on the phone. They weren't sure about the infection in this person, and she wanted him or her to get a procalcitonin. I only heard one side. And after some arguing back and forth, I guess the conversation was done. And then she was talking to her colleague, and then she was saying how, and the colleague, yeah, you just wish to just listen to you. She's like, yeah, I have a lot of experience. It's like, so I don't tell other people what to do. But procalcitonin is not very useful. It came into vogue a few years ago. It already was available, but now the results will take a day or two to come back, so that's not useful. But now you get it back just like a regular lab. But I have found it very unuseful. The guy obviously has infection and the level is not high. I'm not clear the guy has infection level is high. So I've stopped using it. I think it's not so clear cut. But the attending's point was, I need more information and this will give you more information. And I think the resident was arguing that, and I think the resident has a valid point, is I don't think it's actually that helpful. And I feel it's sort of like going to tarot cards or other things, when you just need some guidance and you're not sure. But it's fancier than just flipping a coin when we are undecided. When I was in training, we had this one attending who couldn't decide. He wanted to get all the tests and all the lab, and another CT scan. He wanted to re-review the CT scan with the radiologist because he thought there was something else there that the radiologist didn't call. So he'd go downstairs. He was always there late every night. But did his patients do better? He kept in the hospital longer, but wasn't necessary. He was just indecisive. And the thing is, we can't make perfect decisions. None of us are going to be 100% or even close. And that's okay. Because we can't tell the future. I like to tell my patients, I can't predict the future. Obviously, because if I could, I wouldn't be here. I would have won the lottery already. And then they laugh. But I think that's a reality. I think there's a point where more information is not helpful. In some studies they've done algorithms to try to determine whether or not, using more factors is better. A lot of these are emergency room studies trying to predict if the patient will do poorly if they go home, etc. And they found that having 15 factors is worse than having 5. Because the other 10 are just noise. They're meaningless. And I think that's what a lot of people don't realize. A lot of stuff is noise. You could talk about getting advice, right? You think more people you ask, the better it'll be. But if you ask 50 random strangers, it's not really going to be helpful when it's about your personal life versus a few close friends who know you well. In the world of engineering and science, I would suppose, maybe not, but the concept of noise is very relevant. And we know a lot of things, a lot of data is noise. In fact, that's why the scientific method nowadays with studies is trying to rule out that noise. By having lots of people trying to evenly matching the noise, having large samples, thousands of patients to rule out any sort of random effect. But at the end of it, it comes down to this idea of deciding on a course. And I think it's very hard for many people to make a decision. Nowadays, with the world of options out there, a lot of us have what we call choice paralysis. You go to the store and you're like, I just want laundry detergent. There's a whole aisle full. What am I supposed to get? Just there they went to get some oil. I was like, wait a minute, I don't need a fancy oil. I don't think it fries dumplings that well anyways. But I just need what's good traditional peanut sesame. And then it's like, there's toasted sesame. What's the difference between toasted sesame and regular sesame? I ended up getting canola. It was cheaper anyways. Didn't come in a glass bottle so you don't drop it and break it. Because one time I was riding back and I dropped my olive oil. Luckily it didn't break though. But yeah, people think that more choices are better, but it just paralyzes you. And now in the hospital, doctors are the same. They have so many options, so many tests to do. You just keep running more tests. When do you say I'm done? And we often encounter this issue with patients with chronic pain. They come in with a slight change. We're pretty sure it's just their chronic abdominal pain, but we're not absolutely sure. So you do a study. But we know a CT abdomen doesn't give you all the information. You may need a colonoscopy. Well, actually, there's other stuff. Maybe they need a study for the gallbladder because they have sphincter of Oddi dysfunction. I mean, you could keep running more and more tests. You can never finish. But when do you draw the line? It's easy when they tell you that you're done, because there's one guy who just wasn't waking up. He lives alone, very functional, obviously, and just wasn't waking up after days of being in a hospital. I was telling his family, well, we could do this, we could do that, and I think they were done. They're like, no, 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 I think we're okay. I think he wouldn't have wanted to have been like this. Let's just let him go. But when it's on you, the doctor, to make a decision, when do you stop? When a patient's pushing, when do you say, there's no such thing as absolute certainty, but I'm reasonably sure already based on what we've done, and you don't have anything else going on. Can I say that with absolute certainty? Of course not. But would I bet $1 million on that? Yes, I would. Absolute certainty and reasonable certainty are different things. And I think part of the problem is this idea of absolute certainty or knowing for sure. See, people have this impression that just because you're a doctor, you have a title or a role of authority that you know stuff and it's guaranteed, but it's not. We're sort of all guessing. Some of us make better guesses, some of us make more educated guesses. But we're all guessing in a sense. We don't know the future. But using this newfangled test to try to help us determine that, I could tell you, this idea of infection or not is not quite so simple. You're basically saying, well, can we just ask the body, hey, are you fighting an infection? Can you tell me, is it bacteria or a virus or a fungus? Because obviously treatments are different. Or neither. What if it's something different? Are you just fighting yourself? Are you reacting? Is it autoimmune disease? Of course we can't do that because the body can't talk. It's not even so simple. When we look at an x-ray, you see some white stuff. Is it pneumonia? Well, maybe. It could be something else. But a lot of pneumonias are actually viruses, and antibiotics don't do anything to them. That's where the procalcitonin is supposed to come in. So to determine if you're fighting bacteria or virus. But I think at the end of the day, it doesn't matter. Some stuff we do because we have a protocol. We think out of abundance of caution. This guy's deathly ill. I don't want him to go to the ICU. Just gonna give him antibiotics. Don't be afraid and just say that. Be bold. Explain why you are doing this. There's nothing wrong with that. I have a patient that I think his fever is not from infection. I'm putting him on antibiotics anyways, just in case. And that's okay. We use that for certain indications, and it's justifiable, and even an infectious disease doctor who are in charge of antibiotic stewardship would agree with you. But this idea of getting information to try to sway you one way or another, information not proven, and then telling your resident, no, I'm right, I'm the attending. I don't buy that. If you can't make a decision, just tell people, I can't make a decision. Don't lead them on thinking you have all the right answers. This next piece of the puzzle will finish it. You can't finish the puzzle. You can't make a decision. And that's okay. There may not be any good decision to make. But you gotta make the decision one way or another. And one more bit isn't gonna help. Just like the man who has $1 million already, and people ask him, what do you want? And his answer is, just $1 more.